give the welcoming remarks and to formally start our program, please welcome to the virtual floor the President of the Chinese Filipino Business Club Incorporated, Mr. Alejandro Ko.
Thank you, Attorney. Distinguished Resource Speaker, Special Assistant to the Secretary of Department of Health, Dr. Beverly Lorenzi Ho, along with our moderator of this webinar, Attorney Kesterton Kwa, friends from Rails Association and Civic Organization, fellow CFBCI officers and members, participants of today's webinar, ladies and gentlemen, good afternoon. Welcome to our webinar on what to know, things to know, and know how on COVID-19 vaccine. Today, webinar will discuss a very timely topic essential to combat this global pandemic that we are into. The past few weeks have been filled with news regarding COVID-19 vaccine, which is the general concern of every Filipino and the entire humanity. However, the stigma brought about by the shadow of vaccination program in the past is what many of us fear, making us a bit adamant whether to get or not to get vaccinated. In my personal point of view, in order to keep our economy moving and adapt to the new normal, we need to exclude and eliminate doubts and get vaccinated. This will protect ourselves as well as protect the people we care. For what everyone can be vaccinated, particularly the infant, the senior citizen with health condition, and with those seriously ill. We do believe that this webinar on COVID-19 vaccine could be of great help, for it is vital that we keep ourselves healthy, especially when our life and family is on the line. Thank you. We all learned a lot of this webinar.
Thank you for that wonderful message, President Alejandro. Now, ladies and gentlemen, to formally introduce our speaker, may I call on the Youth Committee Chairman and Director of CFBCI, Ms. Jocelyn C.
A pleasant day to all of you. It is with great pleasure for me to introduce our guest speaker for today. She is currently the Director on Health Promotion Bureau of the Department of Health, a Special Assistant to the Secretary of Health for Universal Health Coverage. She studied elementary and high school in Chiang Kai-shek College, graduated cum laude in BS Biology at the University of the Philippines, Diliman, at the same time receiving a prestigious award as the most outstanding BS Biology graduate and best thesis in microbiology. On April 2009, she finished her Doctor of Medicine degree with an Outstanding Leadership Award in the University of the Philippines, Manila, after which she took her internship at the Philippine General Hospital and once again received an overall Outstanding Interns Award. Her desire to serve the public and her excellent school records led the way to a scholarship grant by Fulbright Scholar and Ayala Stewardship Fund Scholar, where she finished her Master in Public Health at Harvard T.H. Chan School of Public Health in Boston. Do not be deceived by her young looks and age. Her work experiences associated with health started from being a research associate of ADB, or the Asian Development Bank, and with the short span of 2 years, she became a consultant of ADB. Her career in the OH started 5 years ago as the Chief of Research Division for Health Policy Development and Planning Bureau. From 2018 until now, she serves as the Chief Policy Advisor to the Secretary of Health on universal health coverage implementation, develops strategies, and ensures the alignment of reform initiative between DOH, PhilHealth, and other agencies. Starting last March 2020, she became the Director of Health Promotion Bureau, leading the development of policies on minimum health standards required for COVID-19 mitigation and response in healthy schools, communities, and workplaces. And she formulated the 10-year strategic roadmap of health promotion from 2020 to 2030. She oversees the development of social behavioral change communication campaigns and community activation initiatives for various public health programs. Among her tasks is also to facilitate continuous rebranding of DOH communication materials. And now, without further ado, let us all welcome Dr. Beverly Lorraine Ho.
Hello, good afternoon, everyone.
Good afternoon, Doctora.
Hello,
Good
good
afternoon,
afternoon.
Thank you for this seminar.
All right, Miss Jocelyn, can I start na?
Hi, Doc. Yes, you may
You can start now.
So, good afternoon, everyone. Good afternoon, Uncle, Auntie. Thank you for making time to hear this presentation this afternoon. So I think you've heard many things on the news about COVID-19 vaccine in the Philippines, and I will try to simplify everything by summarizing them into 10 main areas. So you will, the presentation is divided into 10 areas. So they are the 10 must-knows or taphang no na din niya about COVID-19 vaccines an siya huy dipin. Okay, so first I would acknowledge several people who provided inputs in this slide presentation, or I got some of the slides from them because we have been organizing a couple of town halls in the DOH with regard to this topic. And I would also like to declare that I have no conflict of interest whatsoever in terms of any brand of vaccines that we're presenting. Can you hear me? Is the audio good?
Yes, Doctora, we can hear you, Doctora.
Okay, all right, thank you. All right, I'll just go ahead. So before we start, let's just look at this graph. No? So basically, this graph tells us that in the past year that we have COVID in the Philippines, who are having COVID. So ige pink siya ko si mga duwe, diba? Ige blue siya ko si mga lame. And then on the left-hand side, si lange age, no? So yung Teng Bin, si 0 to 4 years old, 5 to 9 years old, Cao Lok, he si Pian, Puet Zap He, diba? So as we go down, hige si older population, as we go up, younger population. So you will see on the left-hand side, the cases ho Katsue City, Di Zap He Kao, mga Sa Zap Kao He, so younger. Pero on the right-hand side, yung Siki, no, dahil sa COVID, Katsue City Eka, diba? So that's more than 60 years old. No? So here pa lang in this slide, you will see that COVID affects different people. No? So the people who get COVID but survive are younger, but the people who get COVID and die are older. So this is important as we go to the next parts. No? Next, see severity. No? So when we say you have COVID, it's not like it's lahat tayo the same, no, yung manifestation ng COVID. There's such a thing as mild, moderate, and severe COVID. So when we say mild, parang normal, no, ubos-sipon lang. So the chance of death talaga halos bo, di ba? Kasi uwi nga, di ba? Bo pansentyo, inu symptom. Kapag moderate naman, di pneumonia. Di kiam eng oxygen, pero not necessarily di ki ICU. Less than 1% SC. Pero kapag severe COVID ko, to see ngayon din sa iya din padepeng you, diba, or family members, ki ICU lo. Yaku ng salepay. Di sige o 5 to 10% chance of dying, diba? And no reason, no, na bobe kay admit sa hospital. So by saying all of this, we're saying that tama sa dan slide, important na dan saya COVID really chooses different type of people to infect, no? And COVID has different manifestations in our bodies, diba? So because we know that already, we will go to the first part or the first question, which is why do we need to get vaccinated? Din ka na nakyam ing vaccination, no? So two main concepts lang here. Vaccine ko usay benefits and the concept ng herd immunity na din siguro din taktyo lo, no, na kanat sina 70% of the population needs to be vaccinated. So anige vaccine na benefits ko usay possible benefits or sign outcomes. First is to prevent symptomatic infection. Second is to prevent severe infection. And third is to prevent transmission. Sige si Shami, no? So, ibig ba sabihin din na COVID vaccine, di po COVID lo ba? Not necessarily, no? So, sige sa outcome ko, sa Dr. Edsel Salvania presentation. Pero basically, ikay, describe kanan sige la COVID o kanan si sige lion, di ba? Ya matapang ko. Pero once o COVID vaccine, no, pian sa kwan, no. So first is si sige lion na ti loob ng kulungan, di ba? Ibig sabihin, di symptoms o buwet sulay lo. Di pian parang normal, very mild ubosipon na lang. Second is prevent severe infection. Hige, lion, pian baby kitten, no? Parang kuting na lang siya. Ibig sabihin, mahina na lang. So, di men ki ICU. Di pian parang gutama ho din ko, mild as moderate lang. And finally, prevent transmission. Ibig sabihin din na uko, di bawat lang ho pa lang. So, essentially, parang ikay patay hige COVID sa DS5, di ba? Or parang nag-stop na siya sa'yo. So, sige sa endpoint, gunan science, si Kyoto endpoint, ibig sabihin, sa ways for COVID vaccine to help us as in a community, di ba? Hindi ibig sabihin, only action si go boy, COVID lo. Pwede ka pa rin mag-COVID, pero hindi ka na ma-ICU. No? So, yun. Then, sige, prevention of transmission ko, yung boy kito, tiyo pa lang. Sige, siya ko click kay study pa. Diba? Kasi hige first few vaccines like Pfizer and Moderna, clear evidence pa na inuwat lang prevent transmission. Kaya, di ba, hige advice pa rin, no? Di na even siyam, di ako tiyo wear mask, di ako tiyo physical distancing, di ako tiyo wear di face shield, di ako tiyo hand washing. Kasi, di etswe u COVID, pero di si mild pa lang, di ba? Pian mild na lang, so di etswe hawa pa lang pa rin. Okay? So, hige concept ng herd immunity si Shamia. So, din ko hige dan a picture, no, sa taas tsaka sa baba. Sa baba, yung hige mga orange lang ko si herd immunity. Sa taas, si parang dan current situation. So, di ko hige ang siya kailang to sige ulang o infection. Kapag dan population bot siyam dan si Kyoto naive, ibig sabihin anytime pwede ma-infect, di ba? So dan na Kyoto naive population, no, sige ang shock anytime ikihawa tiyo pa lang. So yung mga blue ikay pienswe ang shock din kang inhawa, di ba? And afterwards, hige lang na ang shock ko sa second box ipian orange lo kasi because iyo ipat o COVID lo ipian o immunity, di ba? So, you will see marami dun sa third box in pian longtong ang shock. Tapos, siya lang, pian orange kasi sila yung nagka-immunity. Dun sa ilalim, si goal ng dana immunization program. Instead of dilatan, di pian orange dahil di natural infection, no? DUPN orange dahil sa vaccination. Right? So, dito sa ECA, di ko kahit uhigi ang siya, higi nakakahawa ilang ko. Ibuot lang to, tiyo pa lang kasi inhiki ang orange law dahil inpien immunized by the vaccine. Okay? So, sige si Dane goal lang. So, maybe, sige, probably din long zong, bo ay no, need to know, no? Pero sa mga mahilig sa mathematics, so kanat sinalekong 37% ng population tiyo bakuna, no? So it is based on the number of people that the virus is able to infect, no? So kapag hige R naught to, R0, no? R naught is 5. Ibig sabihin, for every 1 person that gets infected, iwat lang pasak, hihogoy lang. Yung R naught of 2, ibig sabihin, for every 1 person infected, iwat lang pasak, hinangailang. So, based sa mga nangyayari sa R naught si Shami, between 2 to 3. Ibig sabihin, every 1 person, it infects 2 to 3 other people. So, for herd immunity, a threshold, a formula, si 1 minus 1 over R naught. So, sidang kahit hong mathematics. So, 1 minus natin na number is 67% or 70%. So, higit-higit mathematical basis kung bakit then tiyokyan ang 70% of the population immunized. So, kunwari, sa din community, kunwari din compound lang, bolang, let's ukian So, kunwari din compound, sipae lang. So, you have to think na dapat at least chitsape lang in that compound chamcham or hige immunity. Alright? So, hige tamagwale show din ko si Kyotse, diba, danti acquired immunity. And di what lang immunity from 2 mechanisms. Either naturally they got infected as si on the right-hand side, di hige bakuna, diba, or di hige vaccine. So, higila trigger ko si Kyotse antigen la, diba? So, higip high lang ko, higip ko coronavirus, yung higit sit na nagsasabi sa DSing ko na isipay ko, higit so si higit antigen la. At the same time, higit vaccine ko, yung higit sit ikay gaya, higit component, higit si Kyotse immunogen. So, in both cases, they will elicit an immune response of the body. So, sorry, nabaliktad yung slide si Sigelo. Higit na estimated si ni R naught si 2.5 to 3, no? So, di kayo kuhagi formula. 1 minus 1 over 3 is equal to 2/3 or 2/3 of the population, di ba? So, yon. Now, then key different types of vaccine, no? Baka din po ay ko tayo yalot sige pero then si le show din no na maraming types of vaccines and ditsun po ko for COVID-19 development various types of vaccines are being developed. So, sige naman, slides go be pangho din, no? So, din that's why kayo study afterwards. But what are we saying here, no? So, the immunogen or the ingredient that will trigger an immune response, sige first column la. Now, hige mechanism for action, sige second column. Third and fourth column dan lagong advantages and disadvantages. And sa fourth column, kula show din hige examples ng mga existing vaccine. So, kaya sige first one, attenuated live virus. So, isi live na virus, no? Pero parang pinahina lang, diba? So, pinasok siya sa danesing ko. So, it doesn't cause the same infection. So, matagal na ito ginagamit. Di ko nga tigay examples of measles, rubella, mumps, smallpox. Okay, this is all being used. Yung second is whole inactivated virus. So, sige, influenza, rabies, hepatitis A. Leiyang. Then, protein subunit, flu vaccine, no? Leiyang. Recombinant, sinama siya sa own DNA, so hepatitis B. And then, peptides, replicating or non-replicating na gamit na sa Ebola, and nucleic acid. So yung gaya ng mRNA, no? And DNA. Okay, so sige, COVID pa lang sa leeng. So sige, Pfizer, kaya Moderna, to sige, nucleic acid type. So this is now only being used. So, okay. Sige, si Kwan vaccine ko, go, show, sige, sige, mga picture bawat sige ko in a mechanism of action. Mien kam eng kay memorize, sige. Pero go ay ho, din ko alam ko, sige, part, so, sige, sige, gwala point, ay, sorry. I will go.
Oh, sige, para isi natin.
Arnold.
Okay. So, sige ko din na kay kung hige o word na immune response sa hige siya picture ko. Di ko kung sa sige parang sige sun itsura, di ba? O parang ang siya kay mga dots. No, hige ang siya kay dots to si hige coronavirus spike peptide. Di at so kay siyong kong hige coronavirus o huwag sige flag, no? As hige coronavirus o ti sige boa, di ba? Or maraming boa. Once hige boa, kumatyo ng dane katawan ko, provide immune response. So you will see that in all cases, all types of vaccine, kahit ano mangyari, goal lang ko si hige boa ma-produce no ng dane katawan para diasingkus yung okay, o sige boa lo dan dia produce dan mga sundalo against sige corona or sombrero, di ba? So yun lang yung goal, but there are many ways to make that happen. Sa first part, sa nucleic acid, parang kay Ketty, sige envelope. Sa next part, kay Kele, gene le, no? Kay Kele dan gene. And then sa third part, ihodan hige, boa, pinasa yung boa sa atin, diba? And then sa last part, kay shoot lehige whole virus, no? So in any case din yan, kailangan kay memorize. Sige, go, point lang ko si the body only has to recognize that red dot, no? When the body is able to recognize that red dot, however that is delivered by the vaccine to our body, then the body will elicit the immune response. Okay, so that was the first part. The second, many of you are asking which vaccines will we use. So yeah, so good. Okay, got to choose siya ba, diba? So siyago no siya chite vaccines for which the government is negotiating with the manufacturers. So we call it a portfolio. Kana sina to kam-eng, ya so vaccine na o bikok sa eng nangelang. UK sa iyang nangelang. Kanadan bebwe, chite brand sa because dano sipa sa pemilyon Filipinos bo manufacturer uhat lang hodan hige number of stocks o di siyong kanad siya. Kasi hitsam huay vaccines be produces hitsun ko Bicok and the other bigger companies have already given the companies money for research and development, no? So kumbaga, tumaya na sila dati. Dan sigurista, no? At saka bawal rin sa dan batas, di ba? Kung, paano na yan? Dan lebwe, mga vaccines that are not yet proven, di ba? So, depende congressional hearing, shami buwetso, no? So, we waited. But the other richer countries were able to buy, di ba? The other richer countries were able to reserve just because they provided money when there's still no proof that they can work, di ba? So parang kumbaga tumaya sila sa production pa lang or sa research and development. So, sitsun, all the richer countries have occupied 80% of the global stocks, di ba? So tayo, nakikihati tayo, no? For the remaining 20% with the other poorer countries. And this is the reason why we have to have a portfolio of 7 vaccines. Out of these 7 vaccines, 2 vaccines have already received an EUA, no? And that's AstraZeneca and Pfizer from the Philippine FDA. But yeah, so lang lamang din, so paano na yung ngayon pa the vaccine dan kikiyaw in kong well, dan kikiyaw in negotiate. What if in bopasa sa FDA? Well, then the negotiation will not be carried forward. No? So we are also assuring the public that as long as our experts did not approve brand X, even if we negotiated with them, then we will not buy it. So, alam ko rin na yan, so lang le offer din, boya siya as long as ibo EUA, din bo assurance na it's really good, no? So, I also suggest to not put yourself or your family at risk. So there are many expert groups who help us deliberate on which vaccines to negotiate with and to buy with, no? And these are all flashed in the screen. So there's a vaccine expert panel which asks, should the government allow clinical trials or should we consider it? So yung mga vaccine expert panel lang ko, si more laboratory scientists, no? So they're in charge of clinical trials and they study hige vial lang, di ba? Hige vaccine vial. So hige it na nasa loob, how it's produced, the quality, etc. Then when you move to the Philippine FDA, the question that they answer is really more, is it safe and is it efficacious, no? And do the benefits outweigh the risk? Because later on, sa next slide, ko show din ka na, sige, very unique and mechanism, no? Hige EUA. Third, Hige Health Technology Assessment Council is answering the question, should we buy it? And in normal circumstances, they also answer the question, how much should the government buy it, no? So yeah, so ECOCA in Europe, actually Thai-COX, South Korea, in Sige Health Technology Assessment process ko, sila kong dantyo negotiate at how much, di ba? So dito sa in countries ko, kunwari cancer drugs, piyanyasok, dahil o sige health technology assessment in kong ine-calculate kong, okay, for this particular benefit, guna government, si YouTube, sige, gamot for si Cheng ko kaysa Gotsap Cheng. Ganyan, no? But at this time, medyo mahirap, no? Because there's really lack of supply and dinyan, so si businessman, no? So supply and demand din sa very imbalanced now. Kaya the companies can actually ask more for the price that they can usually give at lower. Then Hige-NITAG, which is the next group, is the National Immunization Technical Advisory Group. They're not just concerned about that vial, no? Si concerned lang about hige injection, but how will it be delivered to the people? Kasi yung pag-check ng vial ng vaccine is very different from assessing kung siya may age tiyo o siya nga itsue vaccine lao heya itsue bo pwet sa phe ishong itsue dit bo baby itsue dit bo. So it's this group, no? Sige, made up of more clinicians more than scientists. And then finally, yung National Adverse Events Following Immunization Committee, so sige mga clinician din, group of doctors din, na check naman ko kung if ever in the instance na ulang ki himatay, ulang ulang ki hospitalized after COVID vaccination, hige ba talaga yung reason? Asi coincidence lang nga, di ba? No, may hige lang si dahil COVID-19 vaccine, pero si dahil pala italaga ki stroke, di ba? So sige si hige group na let's check hige gun causality or reasoning, no? So is it because of the vaccine? Okay, so then sige si dane vaccine development and approval process. So we would like to assure you that there are scientific steps, no, on how this is actually implemented. So dano mga animal studies, so that's the clinical trial, preclinical trial phase, then clinical trial phase 1, phase 2, no? So fewer number of people are required. But when we go to phase 3, more number of people. On a normal time, After phase 3, we finish phase 3 before we give a certificate of product registration. No? Hige to sige FDA permit. But sige si unusual time because of COVID. No? Kaya kahit we're in the middle of phase 3, we are giving the EUA or Emergency Use Authorization. And EUA basically answers the question, is it safe and efficacious? No? Efficacy, efficacy versus effectiveness. No? Dan situn sila kung efficacy pa lang kasi all the numbers that you're seeing in the news, they are based on clinical trial results. No? Si real world pa. Hindi effectiveness, we can only say that if it's already in the real world, no? Let's siyam real people, di ba? So, do benefits outweigh the risk, no? Kasi longtong new technology or risk. Pero, we should think, hige benefit, kakuni ba, kaysa sa risk, di ba? So, if we go through this, we go through all stages, but kahit hindi pa tapos yung clinical trial, phase 3, we already ask the question. And if the answer to the question is yes, based on review of interim data, ibig sabihin, based on review of whatever data they have at this phase, plus there's an emergency which justifies its use, then FDA issues emergency use authorization. The second part is yes, based on review from complete data. No? So, di question siguro, okay na, even Pfizer ba, bo complete pa data, bo pa, no? So, none of the vaccines have complete phase 3 data. Why is that so, no? Last year lang nangyari yung COVID, and last year lang nila ni-start yung clinical trial. For regular vaccine, di long-term effects kasi clinical trial. Actually, 30,000 na lang at 60,000 na lang. They reach it in 1.5, 2 years, 3 years, or even 4 years, no, or more. So para makuha yung ganong number of people, follow up din, no, sa higa trial habang dili kang in-check siya ko din, di ba? So diwat lang sa kung okay by tini higit patient pian anelo. After 1 year and a half, ipian anelo. At this time, di bo, hige information kasi all the trials are less than 1 year old, di ba? But because there's an emergency, there's a mandate to use it, no? So you can also think of it as kaya di sila tong di ba? Di sila manufacture shoes. Pero di ako betong design di ako pa di kaya lang bigla I guess usunog, di ba? Pero you have no other shoes to wear for that particular emergency. So kahit hindi pa tapos yung mga other parts ng shoes, as long as diwat lang kay Cheng lo, di kay Cheng, di betsaw lo, diba? To save your life. That's really probably how we describe the situation now. No? So the risk of COVID mandates that we actually use available technologies who we know are supposedly safe and efficacious. No? So if may indication of safety and efficacy, then we are going to use it. So several different vaccines, the 7 vaccines that I showed you a while ago that the Philippines is negotiating with. We summarized here the number of doses and when they should be obtained. Sorry, I failed to put Moderna. I'll just add it later. So if you look at this one, oops, wait. Okay, so Also put here the temperature, diba? So out of everything, you will see that it's Pfizer and Moderna that requires the coldest temperature. And if Pfizer, you start putting it in lower temperature, then it can only last for 5 days. So the same way for Moderna, it can only last 30 days after you put it in a lower temperature. So yung 2 to 8 degrees Celsius is almost like a regular vaccine, diba? So this is the reason why once we plan the rollout of the vaccines, we also need to know what infrastructure are actually available, di ba? Inuhige ultra high na freezer bo, ultra cold na freezer. As inuhige parang regular cold chain or refrigerator that most of our pediatricians have in their offices, di ba? Kasi hige na bokaw temperature o hige vaccine e paiki. So walang point kandi siyam. Kaya ulang mangwa no. Bet yung nga kung gwa piang UTB kok bekangwa tua sige Pfizer vaccine as Moderna. Bet tualay hui di pinabe kay an hui ki tualay behogwa. Gwa answer si Shamia. Di po sure kasi ikam o possible lang tuat sige ref na negative 70 degrees Celsius sa hui ki ba? It's impossible because you need a special kind of transport mechanism. So granted, iwat lang Pfizer as Moderna through an airplane, hodi, di ba? Very good. But by the time the vaccine is given to you, sira na siya, no? So kahit itsyam pa sa'yo, hindi mo na alam anong effect nun sa'yo. And worse, it could have toxic side effects. So then let's not think of those mechanisms. So out of all the 7, only 2 have been granted EUA. And when we look at the data for most of the vaccines here, the contraindication is mainly for AstraZeneca and Pfizer, history of severe allergic reaction. Okay. So this is from FDA, and what is indicated here really is when they applied to the Philippines. So you will see that Gamaleya, the Russian one, and Sinovac have already applied, but their data are still being assessed. But Pfizer and AstraZeneca, they've submitted and their EUA have already been granted. So unless the EUA has been granted, we highly recommend that you don't get into any agreements to buy these medicines or these vaccines. It's also important to note that many of the efficacy rates that you see on news articles are press releases. So out of all the vaccines that are out there, it's Pfizer, Moderna, AstraZeneca, and most recently Gamaleya that have really published their results in scientific journal articles. So iba yung press release, iba yung marketing versus real peer-reviewed scientific articles. Okay, so do you have to pay for the vaccines or is it for free? So our national government policy is that vaccines will be provided for free. So this is unless, of course, your company signed up into one of those with tripartite agreement. In any case, if you go in to those tripartite agreements, the rule is that this is going to be provided to your employees for free, and you donate 50% to the government. So what are the goals of our prioritization? Maybe in the news articles or news reports, you will see that it's not the entire country who will have the vaccine all in 1 month, right? But very different stages. Part of it is because there's shortage, diba? Sa maguhan din kong 20% of the stocks na lang yung pinaghatian natin kasi 80% has already been obtained by high-income countries. So ito na lang yung natira, no? So dun sa natira, how do we make sure that we allocate it properly? What are our goals? So apart from, we keep saying herd immunity, bakit ba, no? So the primary goal for vaccination would be first to maintain most of the critical essential services, including health. No? So we need to make sure that the health system does not break down like the ones you see in other countries. And for the health system to not break down, you need to make sure that your soldiers in the health system, which are your doctors, nurses, pharmacists, even the janitors who clean the hospitals, etc., your medical frontliners are going to be vaccinated, diba? Second, you want to reduce morbidity and mortality, meaning you want to reduce the people who are going to have severe infection. And based on what I've showed you a while ago, the people who are at most risk for having these infections are these severe infections are the elderly, di ba? And those with comorbidities or bata nga pero maraming ibang sakit, no? Then our secondary goal is to control the transmission and syempre minimize disruption of socio-economic and security functions. And finally, resume to near normal. So there are different priority groups. Now, this has been modified a little bit already to include people with comorbid conditions. So 2 become senior citizens and 3 people with comorbid conditions. Then priority eligible group B and priority eligible group C. No? So then syempre mamaya you will ask, no, nasaan ako dyan? No? So kailangan binabalance lang siya. There are priority groups, but among the priority, meron ka ring ipa-prioritize pa, di ba? So, kunwari, among healthcare workers, din at the area where there's high number of cases or you have more exposure, then you will go first, right? So, for example, if you are a doctor in Manila with high incidence of cases versus a doctor in Batanes, mauna yung doctor in Manila, di ba? At the same time, if you're both workers in Manila, maybe you're both in Philippine General Hospital, if you're a physician who's working in the ICU or of a COVID ward, or in a COVID ward versus a doctor who's doing teleconsultation at home, diba? You're probably a dermatologist, for example, or a psychiatrist, and you can do it at home, then ikaw yung mas last, no? So, ganun yung prioritization natin kasi hindi lahat kayang mabigyan all at the same time. So, question number 5. When and where will I get vaccinated? So the answer to that is it depends on where you fall in the priority groups and when the vaccines are arriving. So I think many of the auntie and uncles here in this call are senior citizens, and so you can expect that you will be one of the first, no? Whether you are public or private sector, you will be covered in the first wave. And when is the first wave? Now, the first wave is coming in this month, February, at least the first 120,000 doses approximately. So that's like lang, no? So 58,000 health workers, and next month, between 5 to 9 million doses will arrive. So that will cover the other healthcare workers and the rest of the senior citizens, no? So auntie, uncle, if you're senior citizens, you will get your shot likely next month, no? So paano to sinasabi, no? Paano na siya mag-go? So then may mga companies, private companies who did the tripartite agreement with the national government. So when can you start, no? If you're part of this or if you're essential worker in those private companies. So as soon as we finish all frontline workers and all senior citizens, we will go parallel na, no? So meaning after the frontline workers and the senior citizens, if everyone is finished by end of March, when all the first few waves of vaccines will arrive, when siguro kunwari natapos na by end of March, if the next set of doses will arrive in April or May, that can go to both arms na, no? So the government stocks can go to the indigent, military, uniform, and Group B, Group C, and then the private stocks could go to their essential workers and the general population. So what we're suggesting here also is to follow the risk rating, diba? So the private sector who bought, and the LGUs who bought through the tripartite agreement are committed to follow the prioritization. So, for example, if you're part of the private sector group, then you need to prioritize maybe your messengers, diba? Or some of your staff who are more exposed, and those who can work from home should get it later. No? So that's the prioritization that we want everyone to work out. Then syempre, many of you will ask, so paano na yan? Go, boy, for my company, employees, then hige LGU, Mayor Isko, ubwe din, Mayor Vico, ubwe din nga. So, sige, yung patong-patong, no? Because all of us can only get one type of vaccine, di ba? And because of scarcity, it is also our ethical or moral obligation that we actually shouldn't hoard the vaccines. And so there will be an IT system, back end, and all of these, making sure that each person will only get one. No? And you have a QR code, a specific code assigned to you that says you got it. So in case in the future, we will have some passport system, etc. on this, then we know who gets vaccinated. So if you got vaccinated from illegal means, sorry na lang, no, you won't get that vaccination card. Diba? So there will also be vaccination post, no? Sige, vaccination si chung our previous or older types of vaccines na okay, gwa ki home service kaya o lang ki kangwa inject sa bahay. We're discouraging that, diba? Because we are aware that in the first hour, anaphylactic reactions can actually happen. So, ibig sabihin, kailangan maging maingat, no? So, we are recommending a fixed post vaccination strategy. Ibig sabihin, your LGUs or the private provider will work with a healthcare provider, so it's an HMO, etc., who will help set up the system, diba, for vaccination. Later on, you will see why. And then we also are recommending that it's a team, no, who will look after or who will do the administration. Hindi pwedeng isang tao lang, no? Kasi meron dapat constantly nag-observe dun sa mga na-vaccinate na. So, in general, this is the entire procedure, no? So, there's a registration in advance. So, we know that, kunwari, si Carol, hindi siya nag-register sa Manila, hindi siya nag-register sa Pasig, hindi siya nag-register sa company niya, di ba? So, all our stocks are coded, no? So, alam natin ilan pupunta sa private, ilan pupunta sa public. So, dapat si Carol sa registration. There's no such thing as on the day, gobikiha na lang, mabavaccinate na ako. Hindi, no? So all of these times that we're waiting for the vaccine to arrive, it's an opportunity for us to register people, di ba? Next is pre-vaccination counseling and consent. This will need to be obtained because as we mentioned, every vaccine has risk, di ba? So kailangan, you will sign, no, that you know the benefits and the risk. Then you will be screened and before you get vaccinated. And finally, as you finish vaccination, you will be observed for 30 minutes to 1 hour. So, hindi parang your usual vaccine visit na diki clinic, okay, chamdeago beto kilo. So, so you have to wait for 30 minutes to 1 hour because this is the time where most of the infection, adverse events will actually surface. And it's better for you to be continuously observed by the healthcare worker. So what do you need to do before vaccination? Obtain accurate information only from the right sources. Always verify what you read and hear from others and declare your complete medical history during screening. So, di ba, ito tago, no, mga information because your doctor needs to know what is really your health situation. So can you choose the brand? So no, unless you bought from a tripartite agreement and you intend to be vaccinated through that. No. So as it stands now, lahat ng nag-order to tripartite, the earliest stocks will arrive in August. No, yun yung indicative. So this is senior citizen and your company ordered for the tripartite. it's likely that it's the government stocks, which will arrive in February and March that you will be able to use kung gusto mo na magpa-vaccine. Kasi the private sector and LGU orders will all come in third quarter pa. So you can choose the brand, and if you want to choose the brand, syempre, diba, it depends kung ano yung dumating. So next month, then sayang ang dadating is AstraZeneca, no? So that will likely be the one administered to our seniors. If Philippine FDA-approved brand, kung ano yung available, yun yung madideliver. Next, can a person decline? Yes, you can opt to decline by signing a waiver, no? But you forfeit your slot already, and you can only be scheduled after the priority group has been vaccinated. So, for example, if you're a senior citizen, you're already allocated, no, a vaccine. Then ayaw mo kasi di ba ay hige brand. Then afterwards, pag natapos na lahat ng senior citizen, tsaka ka na lang ulit mag-get your turn, no? And by that time, if it's still that same brand, sorry na lang, no? But if there's another brand that's available, then maybe you can get that brand. What else? Will a person receive the same brand for both doses? Absolutely, no? So this is the reason why everything has to be very organized, because it's impossible for you to receive one brand on the first dose and another brand for the second dose. So this is not recommended. If you've previously had COVID, do you still need to get vaccinated? The current guidelines is still yes. Do you need to get tested before vaccinated? No. But if you're symptomatic, if you have COVID symptoms on vaccination day, you will not be allowed to get vaccinated, no? So, syempre, ang priority is you need to be isolated first. Okay, what do you do during the vaccination day? So, syempre, you need to go to the assigned vaccination site, whether that's a school, that's a hospital assigned by the LGU. You need to wear your mask, your face shield, etc. And you need to sign the actual informed consent, diba? Then after you get vaccinated, you will be given something like this, no? A card, which I told you has a QR code printed on the card. And you will also receive an electronic version of this card. Syempre, some of the LGUs will provide cards, but that's in addition, no? But there's basically a standard card that will be provided for all of us. On the day of the vaccination, as mentioned, you can't leave immediately. You will be monitored for 30 minutes to 1 hour before you can go home. And you will see here, you will continue to be monitored for 12 months, no, after you get your shot. So, mga auntie, uncle, the important thing here is hindi to pwede tago-tago, no? Bakit? Kasi the drugs are all at the vaccines, as I've mentioned, are all still in phase 3, diba? Wala pa sa kanila natapos sa phase 3. And this is very critical for us to know long-term effects. So this is also the reason why it's important we get the vaccines that we have in the most legitimate manner. Kasi kung may nangyari sa atin, wala tayong panghahawakan, no? Kung hindi legal yung the way that we obtained the vaccines. So, adverse events following immunization, or what we call in medical language as AFI, will be monitored strictly by health professionals. So, we're in question number 8 na. What do you do after you get vaccinated? So, there are many usual symptoms that you can experience. Ano yung mga yun, no? So, meron mga local symptoms, may mga general or systemic symptoms. The local symptoms are here, no? Pain, redness, medyo maga, no? And then, eventually, they become general symptoms. So, yung mga nababasa nyo na parang trangkaso, wakwidit tole, medyo parang pagod, diba? So, that's part, no? That's the regular, considered a regular effect, no? So, differentiate lang natin. So, side effect is the unintended effect of a product no, including vaccines, occurring at a dose usually normally used in man. No? So meron tayong mga regular side effects. But there are adverse events following immunization, and you can only say that this is caused by the vaccine if the group, kanina sabi ko sa inyo, the NAFIC, a special group has been convened to determine whether it is caused by immunization. Then, among the adverse effects, merong serious adverse effect. Yung serious adverse effect is one that results in death, requires hospitalization, or prolonged hospitalization, or significant disability or incapacity, or life-threatening. Diba? So, we just need to differentiate it. So, normally, you do get some of the side effects of pain, redness, swelling. But adverse events have to be recorded, no? But among adverse events, only very few become serious adverse events. Okay, so yung goal natin is to have as little as possible serious adverse events. So now, you will ask, no? There are different types of reactions that your body will have. No? So there are the side effects that I've shown you kanina. So yun yung nasa right-hand side, local and systemic. So pain, redness, swelling, mga fever. Usually, it happens 1 to 3 days after vaccination. Usually, the day after. There are vasovagal reaction. Most occur within 15 minutes. And my immediate allergic reactions, including anaphylaxis or a worse kind of allergic reaction, occurring 15 to 30 minutes after vaccination. So you will see this is the reason why you will have to stay in the facility after you get vaccinated. No, you need to get observed. So anong implication nito, no? If you get Pfizer, for example. So if you've had serious allergic reactions after your first dose of Pfizer, kunwari, you're actually not going to be recommended a second dose anymore. But if it's just the other two on the right, yung vasovagal or side effects ng vaccine, you will still need to get your second dose, no? So, hindi ibig sabihin, pag, nilagnat ako a day after, hindi na ako kukuha ng second dose. No, that's normal. It's your body working, no? Because the vaccine is taking its effect. So, tuloy pa rin, no? It's really only the allergic reactions that's going to stop you from getting your second dose. So, what are the, anong ibig sabihin, no, if you have these? I'll just leave this with you, but essentially, dito, dinedescribe, no, what does allergic reaction mean, no? So, meron kang feeling of impending doom, nangangati yung buo mong katawan, urticaria or parang namamaga, no? Tapos mapula, makate, flushing, angioedema. So related rin siya sa pamamaga. Confused ka, disoriented ka, and then hirap na huminga, nag-wheeze ka na, no? So ito yung parang worst case of allergic reaction that we often see on TV and bring them to the ER, di ba? So ito yon, no? And they need to be injected with epinephrine, no? Saksakin ng epinephrine, titigil siya, di ba? But still, this is very serious. But here on the vasovagal and the local and systemic reactions, you will see mas ganon, no? Mas mild yung symptoms. So, diaphoresis or pallor, ibig sabihin, pawis-pawisan ka, clammy skin, basa-basa yung kamay ko, tapos diabin, feeling mo mainit, ganyan, no? So, they're all normal, no? Normal possible side effects of the vaccine. So I'll just leave this with you so you can read about it. But all we're saying here is hindi siya dapat nakakatakot, no? We all know this is something that we might experience, but because we know the benefits of getting vaccinated are much better, that the option of the vaccine possibly saving you from going to ICU and dying is worse, no? Then just napapawis-pawis, medyo nagkonting fever, medyo masakit yung injection site. Maybe that's acceptable, di ba? Yun yung risk, pero kumpara mo naman sa benefit na hindi ka na ma-ICU, no? So that's how we want to describe it to you and hopefully give you a very informed decision. Next, what do you do after vaccination? So most COVID-19 vaccines offer protection after 2 doses. No? So you need to complete the second dose even if you experience some of the usual symptoms that I mentioned. Health authorities will also investigate if what you felt are actually really caused by vaccine or just a mere coincidence. Question number 9, after vaccination, can I go back to not wearing face mask and face shield? The answer is no. No, we still need to do our minimum public health standards. So some of you might have seen this, the Swiss cheese model, which says no na marami siyang layers of protection that we need to do. There's no single activity that will help protect us. No? So we need to, kumbaga, layer our protection. Ano pa, no? So kung ayaw nyo, mahirap to intindihin, maybe this is more understandable. No? When you go to a certain resort and you don't want to get mosquito bites, diba? What do? Sige, insect repellent, diba? Then you also, instead of wearing sleeveless, you wear long sleeve, you wear pajama at night, diba? And sometimes you even wear socks para nakabalot ka lahat. Oh, pero hindi. The hotel or resort will even put screens, no, on the windows. Ano pa? You will probably sleep under mosquito net, no? Or ano tawag doon? Kulambo, di ba? Tapos kung may butas yung kulambo, doble pa, di ba? And finally, you put katol, no? So, parang kung sa mosquito nga, marami kang ginagawa. No single mechanism allows you to completely stay away from mosquito, diba? So it's the same way, no? For COVID, we need to layer up our protection. And vaccine is another layer that we use. Okay, this is the final, number 10. How do I ensure that vaccines are authentic? So COVID-19 vaccines have to have FDA EUA, and you need to make sure that whoever is handling the delivery has capacity for strict cold chain. No? So maybe some of you are nagde-deliver ng you're in logistics, di ba? Different yung pharma grade logistics versus food logistics, for example. But kung food lang, di ba? Kung dinadeliver ice cream, for example, hindi pwedeng, okay lang, patunawin na lang natin yung ice cream pagdating dun sa tindahan, tsaka na lang ulit i-freeze, di ba? Buwetso no? So you need to make sure it's in constant temperature. The same way for vaccines, because vaccines are biological products. What more? No, lalo na ngayon, we know that when there's a lack of supply, then there's chance for a lot of counterfeit, diba? And there's no way for you to know that something is fake, no? Kasi the vial is plain glass, tapos puti lang yung nasa loob. Is there a way for you to know that what's inside is correct or not? Wala, no? But the lot number, the barcode in the vaccine can help us, no? And FDA, for every batch that arrives here in the country, they actually need to review that. So, 2 things dito, no? Totoo ba yung vaccines na nabili mo? At second, kung totoo siya, na-transport ba siya correctly? Kasi kung transport correctly ko, again, I will tell you, hige vaccine e high key din. So, as mentioned a while ago, the cold storage facility will vary for different types of vaccine. And currently, the government is in talks with several private providers who can provide those ultra cold storage facilities. I think that's the end of my presentation. Back to you, Attorney Kester. Thank you.
Thank you, Doc Bev. Am I still on mute? No. Okay. So thank you, Doc Bev, for that very, very informative lecture. Now, for all the viewers, please be informed that the recording of this webinar will be posted in CFBCI's YouTube channel. Yes, we have a YouTube channel, and it's called the Chinese Filipino Business Club, Inc. You can search it in YouTube. Just type in Chinese Filipino Business Club, Inc., and you will be directed to our channel. Okay, so what's ayat so lang let holan sige recording ko, so di na ay kay kwa din ito ki YouTube tane o guna kay upload din lautem siya Chinese Filipino Business Club, Inc. Diao kang siyong YouTube channel at sulay. Din tiyan hiya wat lang kwantyo. Now, before we proceed to the Q&A, Doc Bev, CFBCI would like to take this time to show you our appreciation for taking the time out of your extremely busy schedule by presenting this virtual plaque of appreciation. This virtual plaque reads, the Chinese Filipino Business Club, Inc. presents this appreciation award to Beverly Lorraine Ho, MD and PH, in appreciation for your contribution as keynote speaker in our webinar entitled What to Know, Things to Know, and Know-How on COVID-19 Vaccines. Your expertise, wisdom, and insight give us hope and empower our community in these unprecedented times, given the 6th day of February 2021. So on behalf of CFBCI and every participant here, thank you very, very much, Doc Bev. For everyone's information, Doc Bev is very, very busy. So we really have to thank her for just, carving out this time to be with us. Now, Doc Bev, if you're okay, can we start with the Q&A? Okay, so we have a lot of questions, but we parsed some of it already, So, Doc, first question, are employers actually required to purchase vaccines for their employees? Now, what is the option for employees whose companies did not purchase vaccines for them?
By default, the employers are not required because by default, the government is committed to provide vaccines to all Filipinos. So they're not required, and the employees can actually make sure that they get signed up in the LGU. So I guess that's one thing that I failed to emphasize in the presentation, that the national government, that by the nature of the DOH, is for more a policy and planning body, and all of the healthcare services are being implemented at the local government unit. No? So kahit we buy the vaccines, the people who will plan where to vaccinate whom, how many vaccination posts you will have, is going to be your mayor or your local chief executive. So you really need to wait for their announcement kasi they have a provincial, city, or municipal health office that plans all of these.
Okay. So Doc, next question. To answer that question again, to remind everyone, no, it is not required. Okay, so kung si lan sang di lang lan kung si tiang hubok yung piak lan tio kalan kang lang boy vaccine. Okay, so just to be clear with that. Okay. Next, Doc, and this is something that keeps coming up in the chat room. Why does this vaccine have more serious side effects compared to other vaccines? We hear so many stories about people who can't get out of bed, chills, sore throats, body pains, etc.
Actually, if you think about it, the side effects are generally almost the same as the previous vaccines, diba? It's just that now, you have more people being vaccinated. So for example, diba, it's always a proportion issue, diba? So kunwari, dati, child vaccination, for example, we only vaccinate like 2 million kids every year. At this one, suddenly, Danbe vaccinate 70 million people in 1 year, di ba? And it's the same in other countries. So, if you say you have for every sipa nga lang, sige, yung magkaka-adverse events, di ba? Or isa yung magkaka-fever, hirap tumayo. Kung yung sipa minultiply mo ng ilan, di ba? So, if dile inject sithang lang. So, 10 lang yung magko-complain. Pero dinale inject 10 million people, then yung sape lang mo magiging ilan, di ba? So it's really just because of the sheer number, no? That's why we think we're seeing it. Second is, syempre, all eyes are on this, di ba? Dati ba kung may bata na may konting side effects, magpapansin ba tayo? Hindi, di ba? Kasi mga bata lang, yung mga mami lang may alam dyan. Pero ngayon, lahat tayo biglang nakikialam kasi part na tayo ng babakunahan. So, it's a scale issue, no? So, parami rin ang parami tayo.
Okay. Thank you for that take, Doc. Doc, what if one develops allergies with vaccine A? So, based on the lecture earlier, they will not get the second shot because they're allergic, right? Can they still be vaccinated with vaccine B after a period of time?
So kaya, 'di ba, we're checking no the different components of the vaccine. So as long as there are not any there will be no contraindications doon sa ibang vaccines, then pwede sila ma-vaccinate doon.
Doc, are vaccines recommended for seniors and those who have asthma, diabetes, high cholesterol, basically complications? Or is there any specific brand right now that is in the forefront that is maybe safer for these people with complications?
So as it is now, if you look at all the EUAs that have been issued, no, walang specific na sinasabi bawal itong certain vaccines for elderly, no, and with comorbids kasi they are precisely the population you want to protect, di ba? So ang pinaka-contraindication na nakikita mo sa lahat na pinakita ko rin in the presentation kanina is really severe allergic reaction, no? So you ask about asthma. So asthma is a form of allergy, 'di ba? We know that mas natitrigger yung mga tao. Pero ang sinasabi dito is severe, no? Ibig sabihin, nagkaroon ka ng past instances na talagang buhat lang hawk-hip, ganon, 'di ba? But if it's more minor type of allergy like some people, 'di ba, pag nadikit yung tummy nila sa zipper, nagkaka-allergy sila. Ganun, may mga minor allergies, then that's probably not indicated, not contraindicated. But this is also the reason why we're telling everyone, no, you need to get the screening done. This is not like, okay, parang go IQ Mall, gusto ko bumili, ito na. Hindi, no? So you pre-register and you really need to go and see your healthcare provider to get screened correctly. No? Kasi minsan parang feeling mo wala. Feeling, di ba, ay tiya, kwenang lang. Pero apparently, sa kwenang ka pala merong allergy, di ba? So, nasa-screen ka properly and that's really the important part here.
Okay. Doc, a follow-up question to that. I've tried to, take out as many questions that relate to a specific vaccine, to specific vaccines as much as possible. But there's just overwhelming interest in this one particular brand, which is Sinovac. So many people are asking, what's the current literature on Sinovac? Is it safe for those ages 18 below or 59 up? Because there seems to be a lot of conflicting news regarding the brand right now.
Okay, so as I mentioned also in the lecture kanina, 'di ba? We are, at least kami, no, we based our assessment and our expert based our assessment on real reports that have been handed in by the companies and published literature, no? So when we say it's published, it's not published in a newspaper, no? It's published in a scientific journal. Bakit scientific journal? Kasi there is a process na other scientists actually look at it, no, before it gets out. Ibig sabihin, di a formula, i-check kung you really computed it correctly, di a methods correct mo. So as of this time, the Chinese vaccine has not yet published officially, no, in a scientific journal. And we're not discounting the fact that they might actually release something in the next few days, di ba? So meron na sila, I think, in Chinese literature, di ba? But hindi pa in our mainstream in scientific journal. They've also submitted their dossier, what we call it, so all their files to FDA already after may mga follow-up inquiry yung FDA. So all I can say now is once the FDA hands out its decision, rest assured, no, that that's going to be a reliable assessment. Kasi they gave Sinovac a lot of chance to submit ano man yung kulang, etc. Diba? So it was submitted, I think when I showed you in the slides of USEC Eric, last month, tapos this month may mga pahabol, no, na binigay. So ibig sabihin the assessment is ongoing and before the end of this month, hopefully we can get the final results, no. And through the EUA, ilalabas sa EUA kanino siya pwede, kanino siya hindi, no. So I will be very careful about addressing that. Basta once nalabas yung EUA, you will be able to rest easy na assess ng mabuti lahat ng kapapilan niya.
Okay, Doc. I'm not sure if there's an answer to this already, or if it's just very basic. Someone asked, if you have been injected with the vaccine, how many months are you protected from the virus?
So the answer to that is we don't know. no? Why? Because as I've mentioned to you, the studies are rolling, di ba? So I think at this time, in the last interview of Yusek Eric, yung so far alam lang natin is probably it extends to 6 months, 9 months, but we don't know, no? Because the nature of the data is hanggang dito pa lang talaga natin alam kasi ganito lang kahaba yung trial natin, di ba? So, ang sagot natin doon is kaya constant tayo lahat minomonitor and the companies have committed na tuloy-tuloy pa rin yung trial nila, no? Di ba I told you kanina, clinical trial stage 3, they're still not yet done, no? They're continuously getting data, meaning everyone who's joined their trial are continuously being monitored to track whether nagkasakit pa ba sila, etc., no? Because we don't know. That's the science of it, and we're very transparent about it. So if after 1 year it shows that kunwari you can only be protected every year, then it means parang flu vaccine tayo, di ba? Every year nag-inject tayo ng bago. Pero if lumabas sa study na nako, di what lang protecti ng SANI, o di every 3 years tayo magbabakuna, no? Baka lumabas din goni tsapni after 10 years, no? But at this time the evidence is limited, so we don't know.
Okay. Doc, question again. What is the COVAX facility and how does it work?
So the COVAX facility was built with the support of WHO, but Gavi is the lead, no, the Global Alliance for Vaccine. So in the past, the Gavi has worked to help poorer countries be able to access mga vaccines for babies, no? But this time, they anticipated this problem that the rich countries will be able to buy the stocks. So what COVAX facility did was it got money from different donors and they pulled all the needs of the low middle income country. So they're committed to make sure that there's stocks for 20% of the population. So we depend if we have 100 million Filipinos, they commit to make sure there's available stocks for di tsaptange lang, diba? So this facility makes sure that stocks is made free for us, no? But recently, there has been challenges on funding, so they can only commit, no, na 15% of that 20% is for free, and the 5% dan kay kitsi bue. Pero because it's a subsidized rate, the rate for each dose is like chit kogun bikim $7, no. But in any case, they're a facility that just pulls stocks, no. So imagine mo NCD purchaser, global purchaser.
Doc, how prepared are we in the logistics side, like cold storage? We've heard, that news outlets have been making this an issue, but in reality, is it really that bad, or it's not really that bad?
So I think I will answer your question in two ways, no. So first, if we're talking about -70, no, availability of the -70, which is more for Pfizer and Moderna, then it's a challenge, diba? Kasi those refs are not everywhere in the country, diba? Hindi lahat ng city meron, etc., no? But that said, we also know that our vaccine portfolio is many, diba? Parang hindi naman Pfizer yung bibilhin natin like other countries eh. Konti lang yung Pfizer na bibilhin natin. So we strategize based on that, di ba? So saan mo dadalhin yung Pfizer? Sa lugar lang kung saan meron ka nung ref na yon, di ba? Which is where? Your big cities, di ba? Then, for Tiswateng, Timas rural area, meron ka ng regular cold chain facility, which is ginagamit natin for vaccination ng mga bata, di ba? That's your 2 to 8 degrees Celsius. So it's actually not a difficult scenario. And that's why we buy most of the other vaccine types, di ba? The AstraZeneca, all the others in the list of 7, 5 doon, hindi kailangan ng ultra high temperature, ultra cold temperature. So, ganun natin siya plinano. Kaysa, i-goal pa ba natin bumili ng freezer at mag-install kung saan-saan sa buong country? No, no? Na, hindi rin yun practical. So, did I answer your question, attorney?
Yes, Doc. Thank you. So I'll be just three more questions, Doc, and then we will let you go. Sorry for taking up so much of your time. Um, Doc, does higher efficacy translate to higher effectiveness? I- I'm not sure if you answered this earlier, but someone is asking this. I know does higher efficacy translate to higher effectiveness?
So as we're saying, no, efficacy is its promise, no, based on laboratory studies. So parang sinasabi nila, yung efficacy, yung best case scenario mo, and then yung effectiveness mo, yung parang worst case scenario mo, no, kasi that's what when the rubber hits the road. So siguro yung mas importante natin sabihin is yung efficacy siya in terms of the three endpoints that I talked about, di ba? Efficacy in terms of preventing transmission, efficacy in terms of preventing asymptomatic infection, and efficacy in terms of protecting you from severe infection. Yung most of na nababasa natin, 95%, 94%, it's efficacy in preventing symptomatic infection, di ba? Pero, pag tinignan mo, pwede mo rin i-compare silang lahat sa efficacy in preventing severe infection. So, ako, personally, if you're an elderly, yung titingnan mo is ability to prevent severe infection, di ba? And that's actually one of the arguments for one of the brands ng vaccine na pwede siyang mababa dun sa like 65-70% siya efficacy in symptomatic, in getting you to have symptomatic infection, pero 100% pala siya in protecting you from severe infection. 'Di ba? Ibig sabihin, pwedeng okay, mas mababa siya to get you to have COVID, pero sobrang make sure niya na hindi ka magiging severe COVID. So for me, we have to look at those three endpoints that I mentioned earlier in the presentation.
Okay. Doc, second to the last question. If someone has already developed, well, sorry, let me rephrase this question. If someone has already contracted COVID, do they still need to be vaccinated?
Yes. No. So, and the main reason for that, and even if you've gotten yung mga plasma therapy, di ba? Or some got monoclonal antibody, the current suggestion is still, recommendation is still to have the COVID vaccine. No? Bakit? No? It is related to, sinasabi nila yung length of time and yung amount ng antibodies that are present in your body. Sabi nila, pag normal infection, it can wane earlier, possibly can wane earlier, and so you might need to have it. My teacher is also here, si Ma'am Anna. So I would just probably like to reemphasize what she mentioned in the chat box, that we have to realize that regardless of the published efficacy, we have to make sure that we know that yung current protection natin is at 0. So any protection above that is actually already good, no? So parang kumbaga better na may 50%, 70% protection ka kaysa 0 protection at all.
Correct.
Thank you, Ma'am Anna.
So yeah, so many people, I think that was a very big issue, no? So last, Doc Bev, can you briefly educate us on how these viruses mutate and its danger or virulency, if that's the correct term, since there are quite a few variants out already?
I think it's important. When I was in college, one of my professors would describe mutation as parang tumatakbo ka ng sobrang bilis. So if you run so fast, wala kang choice, matitisod ka. 'Di ba? So it's much like that. No? So since the virus, you keep transmitting it to other people. So the chances of you having mutation is going to be higher. And this is the reason why we actually are racing, no? Hindi parang patagalan bago ma-immunize natin lahat ng tao. Yung goal natin ngayon is to immunize as many people as possible because the more natin pahabain to, the more transmission will happen and the more mutation will likely happen. So it's like parang nakikipag-race tayo dun sa virus.
Okay, sorry, Doc. May sumingit na one last question. I think this is quite short, no? Which is, where can private entities join the tripartite agreements? Can businesses do it on their own, or do they have to course it through organization?
Thank you very much for this question. I think what we need to realize, no, bakit yung companies, marami kasi nagtatanong, bakit pa kailangan dumaan sa tripartite, no? Dumiretso na lang kami sa companies, sa Pfizer, ganyan. The question is, they don't want to work with you directly. Why, no? As we mentioned, the vaccines are still in the middle of the trial, di ba? It's like us telling the companies, no, we want to use your product kahit di pa siya completely done, no? And if you will look at the terms of this, the companies are not going to be held liable. You're a lawyer, no? So they're not actually going to be held liable kung may mangyari, no? So the liability is actually with government. And this is the reason why they want to partner with us. Because the government will actually, kami yung sasagot, no, kung may mangyari dun sa nabakunahan. Now, why are they not doing that with the private sector? Because will private sector sagot? 'Di ba? Hindi eh, 'di ba? Ayaw mo din, no, na ikaw yung sasagot. So, this is the reason why tripartite siya. Na-allow po lang yung private sector to put in money, but essentially, the authorization to distribute and to use it, the company is partnering with the national government for that. So, no, you can't do it directly. You always have to do tripartite. And that's also, I guess, for your protection as private companies.
Okay, Doc. So again, thank you very much, Dr. Beverly Ho, everyone. She really took time away from her very, very busy schedule. So we will end our Q&A portion here. Again, everyone, if you're interested in reviewing this webinar, you can access it through the CFBCI YouTube channel. So just go to YouTube and search Chinese Filipino Business Club Inc. And you will have access to all CFBCI webinars. Okay. Now, to formally close our program, may I call on the Executive Vice President of CFBCI, Mr. Stephen Shea. Mr. Stephen?
Good afternoon. On behalf of the Chinese Filipino Business Club, I'd like to thank you, our energetic Department of Health, Assistant Secretary Dr. Beverly Lorraine Ho, for sharing your precious time and a very, very comprehensive explanation regarding vaccine. I'm very sure we are in a positive note and feel confident to be vaccinated. And also, thank you to all our participants this afternoon for your support and making this webinar a great success.
Okay.
Again, Chinese Filipino Business Club will continue to take part in disseminating information through webinars, especially in these trying times. Again, thank you and have a meaningful weekends.
Okay, everyone, that ends our program today. Again, thank you everyone. Thank you very much, and have a great weekend.
Thank you.
Thank you, Doctora.
Thank you, Doc.
Thank you.
Okay na po.